So we should all be in charge of our heart health. So if we go to the doctor, what should we insist or ask that the doctor test for?
Let me, if I may, answer that just a slightly different
Sure.
way. We should all be in charge of our health. That's been my mission for the 20 years I've been in this field, is to empower people to know about what they need to know about it and to be the head of their own health team. The Nurses' Health Study, which is the longest running epidemiological study of diet and disease ever done, it's over 100,000 people followed for over 3 decades, out of Harvard. In the Nurses' Health Study, the research very clear, all published, 82% of cardiac events, of cardiovascular events, could be prevented by adhering to 5 basic principles. By the way, none of them have to do with lowering cholesterol. Here are the 5. Regular exercise, moderate alcohol, no smoking, maintain a healthy weight, and eat a lot of fish. Basically, if you do those 5 things, you can knock out 82% of cardiovascular events. It has nothing to do with cholesterol. So you go back to, what do you ask your doctor? You certainly ask for the particle test. That's number one. If you want to know anything about cholesterol, you look at your triglycerides. You look at inflammatory markers like C-reactive protein, and there's a lot of others that they can check for as well, because you want to see what kind of state your inflammation is in. You want to see whether you have high triglycerides. What your triglyceride to HDL ratio is 16 times better predictor than cholesterol for whether you're going to have a heart attack. So in other words, if your triglycerides are 100 and your HDL is 50, you have a ratio of 2, 100 to 50 is 2, you ain't having a heart attack. When that ratio starts to ease up to 4 or 5, you're at some risk. So you need to drop your triglycerides, because once you drop the triglycerides, the ratio improves even if HDL doesn't go up.
Okay.
Then there are other tests, and we talk about them in the book, fibrinogen, things for clotting factors, stuff like that. But basically, we got to get out of the idea that this is all measurable in the blood. There are lifestyle choices that impact the heart enormously, stress being one of them. Stress is very inflammatory. If you buy my theory, that it's not just my theory, but if you buy the theory that I believe in, which is that inflammation is at the cause of heart disease, you want to remove as many inflammatory substances from your diet and from your life. Stress is highly inflammatory. People die from stress. Stress can kill. Right in the Northridge earthquake, where I live in Southern California, they had an earthquake in Northridge, and 5 times as many people died on that day as any other comparable day in history. So maybe it was a Tuesday. They go back the year before Tuesday, the year before Tuesday. 5 times more. None of them died in the earthquake. They all died from heart attacks. So stress can even cause death. And the hormones that are released during stress are very inflammatory. They cause lots of biochemical mischief. So reducing stress is probably a huge factor and far more important than lowering cholesterol.